Good evening. Thanks for joining us tonight. I'm Lauren Maloney. First on Local 22, UVM Medical Center is responding tonight to a claim it forced a former nurse to participate in an abortion despite her moral objections. Local 22's Devin Bates spoke with the medical center's interim president. Devin is live tonight in the newsroom.
Well, Lauren, this particular procedure happened in May of 2017, and after the medical center conducted an internal investigation that found no wrongdoing, the nurse brought the complaint to the Office of Civil Rights at the U.S. Department of Health and Human Services. They've confirmed the complaint, but tonight the medical center is saying it's a little more complicated than that. UVM Medical Center could be at risk of losing $1.6 million in federal funding over a complaint filed by a former nurse. The nurse alleges in May of 2017 she was forced to participate in an abortion procedure despite moral objections. After hearing from the feds this week, the medical center's interim president, Dr. Leffler, has taken issue with it.
We did a thorough investigation of this case, and we refute the findings. We believe the facts don't support their conclusion.
The internal investigation took place in the months following the procedure. In May 2018, the nurse took the complaint to the Office for Civil Rights at Health and Human Services. In a letter laying out its findings, HHS claims it offered the medical center multiple opportunities to respond and provide evidence. Dr. Leffler says his staff did reach out.
We offered to meet with them. We offered to share our policy with them and get input from them on how we might be able to strengthen the policy to protect our patients and staff, and they did not take us up on that. We're somewhat disappointed they chose to bring this out into the media yesterday rather than coming and working with us.
The medical center said they can't go into details regarding the complaint because it involves patient care and personnel matters. But Dr. Leffler said hospital policy states that in rare circumstances, such as a life-threatening situation, employees could have to participate in something that makes them uncomfortable. The nurse's attorney believes that's against the law.
If you really read that statement, it says, well, if we can accommodate you. And that's what HHS found. That's not the rule, that's not the federal law that was passed by Congress. That's not what HHS enforces. It's not if we can accommodate, we'll accommodate you.
Now, Jordan Seculo said there's at least 4 other nurses at UVM Medical Center who said they've been involved in similar situations, and the American Center for Law and Justice, for which he works, is launching a campaign asking medical professionals to let them know if something similar has happened to them. Live in the newsroom, Devin Bates, Local 22 News.
Devin, part of Interstate 89 was closed